So it is really important that we make sure these guidelines are really fine-tuned because we are seeing people living longer with type 1 diabetes, living healthfully with type 1 diabetes, and we want to make sure that we give them all the tools to keep doing that, especially with exercise.
Living with type 1 diabetes is already challenging, and for many, the idea of taking part in physical activity and burning through their energy can be scary. Combine that with checking their blood sugar levels and managing their insulin injections. Drops in blood sugar can be dangerous, and a drop severe enough could lead to more health risks, landing them in the hospital. This risk is especially high for postmenopausal women, a group that's been under studies but faces the greatest danger due to significant muscle and bone loss. The team of Institut de Recherche Clinique de Montréal is currently conducting a study to determine how to safely engage in physical activity for this group.
We know that exercise is really important for people who are living with type 1 diabetes, but we also know that the biggest barrier to exercise is fear of hypoglycemia, fear of going low. So if our current recommendations for insulin adjustments aren't appropriate for that particular group, we might find that they're going low more often or that they're going high, because the second barrier to exercise is actually loss of agency over diabetes management, so more highs and more lows.
Current guidelines recommend that individuals with diabetes engage 150 minutes of exercise per week. For those with type 1 diabetes, there are also specific guidelines on adjusting insulin before and during exercise to help prevent hypoglycemia.
The problem is that all of the instructions are based on data that were collected in men. So we're not sure if they're even appropriate for women, and especially not older women, because those studies, not just men, young,
women
fit men.
with type
so
1 diabetes
it's kind of time to really take a close look at these data now that we can really fine-tune insulin before exercise, during exercise. Any movement is good movement, especially when we're, over the holidays, tend to take a break and sit down and enjoy a lot of really good food. I think it's really important that we also take the time to enjoy some movement with our families, with our friends, whatever it is that you enjoy, get out there and do it, because it's always going to make you feel better.